44-bedded home and it's split over a few floors. We look after people from the early stages of dementia right through to their end stages. We have qualified nurses on duty day and night to make sure that all their needs are met medically. We're a stone's throw away from the beach. We spend quite a lot of time taking the residents down along to the local village and town. It's one of the most popular seaside destinations on the island.
Here at Highfield, we provide a person-centered care. We get to know the residents when they come over to us. If we find out any dislikes and likes, then obviously we make sure that we update the care plans regularly so we know as much as it's possible about the residents.
We have a fabulous team of carers. They're compassionate, they're caring. And then our qualified nurses, they're always encouraged to make sure that they're continually learning throughout their careers so that we can bring best practice to the home.
Here at Highfield, meal times are really important. We cater for all dietary needs.
We have a seasonal menu at Highfield, but the residents are always encouraged to make a choice of what they would like to eat. We make sure that we listen to what our residents need. We run activity sessions tailored to their needs. It may be on a one-to-one session, maybe having a manicure or some massage therapy for people that are not able to get out of bed. And then we have our group activities, armchair exercises. We will try our hardest to make sure that they enjoy every moment of being here. Technology is a huge part of life nowadays. We make sure that we try and include that in our care for our residents. For instance, we have a huge tablet. It's a huge screen that is very interactive. We do lots of reminiscence with it.
We have a lovely team here. They will always support you. Because we have such a strong team here at Highfield, our residents get the best care.
Hartford Care have a set of values that means that our residents are the heart of what we do and who we are and how we act.